Hi everyone, my name is Cynthia. I'm a Walgreens pharmacist and I am excited to talk to you today about diabetes.
I'm Eric. I've been a diabetic now for about 20 years. I found out one day when I was out of town, I had got really sick, and I didn't know what was wrong. Drinking a lot, actually becoming real thirsty and drinking a lot of slushies, and that made it worse. And when I finally went to the hospital, they found out that I was a diabetic.
Hey everyone, my name is Shelly. I am a type 1 diabetic, and I've been a type 1 diabetic for about 5 years, and currently obviously managing with insulin. And I found out that I was a type 1 diabetic right after I was married. I started feeling really tired and just kind of run down all the time. Kind of related it to just, planning a wedding and doing, things like that. So yeah, I've been just on insulin injections, and I have a Dexcom to monitor my blood sugar, which is awesome.
Hello, my name is John. What happened was in 2016, I had a lot of pain in my feet and my hands. It was with the nerves. And like everybody else, I got on the internet and I thought I could self-diagnose this. And obviously that didn't work out. So after about a week of not sleeping, I decided to go into my doctor. And he said, listen here, there's one of a couple things you could have. And one of them being heart disease or diabetes. He ran the full gamut of blood work. I went back and he had said, you have diabetes. You have type 2 diabetes.
Hello, my name is Deborah and I'm from Chicago. I've been a diabetic for over 25 years. I'm managed now with insulin. I realized I had diabetes about 2 years after I became a cancer survivor, pancreatic cancer survivor. It's one night I was at work. I was extremely thirsty, and normally people just drink whatever they see, and I was so thirsty, so I kept drinking, and I knew something was wrong, so I checked my blood sugar. It was 500 plus, which that alarmed me. The next day I went to my doctor. I was a diabetic, type 2 diabetes. Put me on pills at that time. And after a while of being on pills, I advanced to insulin. Initially, I was afraid of insulin, but I discovered insulin is better than the pills. After that, I had a autoimmune disease, which destroyed my liver. Then the diabetes destroyed the kidneys. So I was in kidney and liver failure at the same time. Luckily, I went on the transplant list. After 2 months, I think, I received my kidney liver transplant from Northwestern. So that was 2018. And since then, I've gained my weight. I'm feeling good. I'm doing good. And I'm extremely happy to be here.
It's so nice to meet everybody. Really today, the idea of the call is just to have an open discussion about diabetes, how it's affecting everyone's lives, and just to address if there's any questions on any kind of medications or lifestyle. Also, just to let you know the way that Walgreens can help support you as individuals and as patients while we live with diabetes.
They say there's a massive amount of the population. I don't want to throw a number because I'm probably wrong, but it's way more than I ever thought were pre-diabetic or being diagnosed. And I mean, we all know the reasons why. I mean, people just aren't as active.
John, one of the best pieces of advice I feel like I give anybody, because yes, the numbers for pre-diabetes are alarming in this country. The number for people with diabetes who do not know is alarming, and the ages are getting younger. So my advice that I give to every patient, whether I know their A1C or not, just to make sure once a year a physical is completely covered by your insurance company. What if they don't have insurance? Definitely there's a lot of doctors' offices that would do discounts for patients who are uninsured, and it's just your once a year checkup, once a year to say you're okay. So I definitely recommend that for all my adult patients, and just to have those numbers checked, it's huge.
I remember Deborah saying that insulin was better for you, but I'm not too familiar with insulin. I used to take insulin when I first got it about 20 years ago, but then I decreased it myself and started taking the pill. So now they're saying I have to go back on the insulin.
Okay, so yes, definitely. Insulin, think about it as kind of the end all be all of treatments for diabetes. We try to do pill form just to definitely make it easier for your lifestyle. It's way easier to take a medication than to inject, but insulin will bring the sugar down right now. So what they're seeing is when that sugar's high, damage is being done to your body, damage on the inside. So we want to stop that damage as soon as possible, and insulin will do that. Now, I want you to think about it. Sometimes regimens do change for diabetes, and say, you tell the doctor, hey, okay, put me on insulin, but I'm going to do everything I can, start trying to exercise like the 30 minutes a day, 5 times a week.
I will say, like, normal, workouts that I typically do on a daily basis, they do keep my blood sugar within range. And my doctor said it best when I was pregnant and continuing to work out. She said, working out is going to be the best medicine that you can do to keep your sugars down, obviously, besides insulin.
We are all creatures of our routine. Whatever, your routine has been to eat or plan for the next meal and go to bed, it's going to be at first an active decision that every day you're going to have to be like, I'm going to do this for me.
Well, what I know now is diet. Diet is very important. I have to make sure it's a balanced meal. I have to make sure I have my complex carbohydrates in there, not simple. So over the years, I have learned how to eat. And I try to teach other people now. You just can't eat anything you want.
For me, it's a little bit different because I've always been like a thin person. So it wasn't more so diet. I believe it was more so hereditary for me. Mm-hmm. So, but now that it's been so many years, the diet does come into place. I used to like to have a lot of coffee with sugar, so I've cut that out. So just things like that, but I never was a big eater. And people always look at me, well, how are you a diabetic? Because you're kind of small. So they always associate it with eating a lot. So, but it wasn't true for me.
Definitely huge hereditary part. So what I would like to share with any patient who is newly diagnosed with diabetes is to not feel alone. Don't feel like they're in this by themselves. They do have people that want to help them. So whether that's their primary care doctor, if that's where discovered it, or the nurses there at the clinic, your pharmacist. So anybody who's going to be giving you a new medication, please take that time to sit down and learn about it, learn about the side effects.
Talking, with your pharmacist, like you said, is always a good resource. I think I could do better at that. I tend to just pick my medication up and go home. So I think it's a good reminder that you telling people to communicate with people that are, on your, healthcare team to try and get the best care you can. In the beginning, you just don't know very much about it, and so you think the minute you have a high blood sugar that your life's going to end and you're going to die and all these things. And the reality is if you can, maintain a good A1C and, correct quickly if you do get high, it's one of those things, it's a marathon more than anything. So I've learned to just kind of not stress over the small things. And I wish I did that a little bit more in the beginning. Thankfully, like I said, my husband was very supportive and kind of helped me work through it. And you just kind of learn as you go. And I've learned to just kind of adapt as needed,
Well, I would say it's not the end of the world. You will make it through. You just have to, adjust your lifestyle just a little bit.
Yes, exactly.
So listen to your body. Listen to your body for sure.
Yeah, listen to your body.
I was that guy that, I'm not sick. I don't need to go to the doctor. And this single event has changed how I look at healthcare. In the light of healthcare, that's how I look at it. I'm very preventative, because when I was at work, I did preventative maintenance to all my equipment, all of my machinery, all of my stuff. It comes to my lawnmower, my weed eater, my house, everything. I'm very precise with it. But my body, I just wasn't taking care of. It's no different than a machine.
Absolutely. So that's a great point. So you were doing all of the maintenance work for your equipment, everything to keep your business running, but maybe not for yourself.
And I think I kind of pushed myself into it because I got out of it so quick. It made me wonder, did I do this to myself? Maybe when I'm 55 or 60, maybe I should have this. Maybe it's something I'm going to have, but I think I might have pushed it early. Those are just guesses, and I know that, but it helps me sleep at night a little bit knowing that I can control this, that you can control this if you just do what you're told and you stick to the plan. You can, and it's a challenge every day. It's a challenge that once you do it and you get rid of the sugar, you don't crave it.
You can have a slice of the pie. You can have a slice of the cake, but don't eat the whole cake. Don't eat the whole pie. Just a little slice, a little taste. Because the minute they start denying themselves things, they crave more. So I try to get them to understand you can have a taste, and you don't have to have the coffee with sugar. I tell them your body gonna get used to not having the sugar.
I would say, do your due diligence on everything. You got to attack it. I mean, feel bad for yourself for a week or so and ponder everything, and then look at it as a challenge. I mean, you can absolutely beat this. Your body will adjust. It's like getting a cut on your finger. It heals.
Said my biggest frustration just in general is with diabetes period is people, think you just take a pill or take a shot and you don't have to think about it anymore after that. And I'm always swiping on my phone to see what my blood sugar is. And I always tell my husband that, I would be like perfectly fine being a diabetic Monday through Friday.
Like a weekend break.
Yeah.
So you feel it's a
Yeah.
full-time job, overtime. I understand completely. Okay, everyone. I would just like to thank every one of y'all individually for taking this time out and talking with me about your experience with type 1 and type 2 diabetes. I definitely learned a lot from you. Hope I was able to give you some advice. And again, I appreciate you.
All right. Bye-bye.
Bye.
All right. Thanks, Cynthia. Really good.
Well, thank you. I really appreciate everything. And it was wonderful and amazing talking to you and getting the information that you had.